So hello, everybody. I'm excited to be here today and go over some very important topics and very timely ones with safety in the time of COVID-19. Today, I will be going over how you can protect yourself and your family from COVID-19. We'll also be talking about proper use of face masks and COVID-19 safety as it relates to pregnancy, breastfeeding, infants, well-child visits, and childcare. And I realize that there's a lot of questions about these topics, especially for new and expecting parents. So let's get started and just go over some of the general safety information about COVID-19. The virus is thought to spread from person to person between people in close contact, and we define close contact as 6 feet or less. And it's through respiratory droplets that are produced when the infected person coughs, sneezes, or talks. And some recent studies have suggested that COVID-19 may actually be spread by people who are not showing symptoms at all. So there are some steps that you can take to prevent COVID-19. So first off, you can wash your hands often. Using warm water and soap and sudsing up for about 20 seconds is good to prevent the virus. If there is not soap and water available, hand sanitizer with at least 60% alcohol can be used as well. And for hand sanitizer, you just want to rub the hand sanitizer over the surfaces of your hands together and just wait until your hands are dry. Another thing that's important to do is avoid close contact with people, especially people who do not live in the same household as yours, and in public situations as well. Another thing you can do is wear a mask that covers your nose and mouth when you're in public places, when social distancing is hard to maintain, and when you're not with anyone from your household. And then also cleaning and disinfecting frequently. You'll want to use like normal household disinfectants should work for that, and doing high touch surfaces like countertops, tables, doorknobs, light switches, computer desktops, toilets, sinks, faucets, those kinds of things. Other helpful safety tips would be to not skip healthcare appointments, especially during and after pregnancy, and if you have any chronic medical conditions like obesity, COPD, those kinds of things. Another one that's good to do is also to stay up to date on recommended vaccines. The flu is another respiratory virus that spread person to person, and it has similar symptoms as COVID-19. So getting your flu shot is really important, as well as the other people in your home getting the flu shot as well, so they can protect themselves and you, especially during pregnancy and after a new baby is born. We just don't know yet how the two viruses will interact this upcoming flu season. So it's good to protect yourself with a flu vaccine. Another good vaccine to get is the Tdap or whooping cough vaccine, and that is offered during pregnancy, usually in the last trimester, and it protects your baby from whooping cough before they can start getting that vaccination. And whooping cough is another respiratory virus that could have similar symptoms as COVID-19. Right now, there is no vaccine available yet for COVID-19. It's also important to remember not to delay emergency care if you need it. If you're having a medical emergency, definitely call 911. If you're pregnant and having an emergency, you can call the emergency center before you go there, let them know that you're pregnant, and they should have a plan in place to help prevent you catching COVID-19. So the next thing we will talk about are face masks. And there are a lot of questions regarding face masks right now. So we'll kind of jump into that. So who should wear a face mask? People over the age of 2 years old should wear a face mask, especially going into public places and if you're around other people who do not live in the same household as you. The CDC does recommend that you wear them. Other people, people who think they have COVID-19 or who have been diagnosed with COVID-19, generally, if you are sick or think you have COVID-19 or you were diagnosed with it, you should stay in your house and avoid going to public places. You should avoid having close contact with anyone in your home as well. So if you can stay in a separate bedroom and use a separate bathroom during the illness. If you do need to go into those shared spaces in the home, like the kitchen or something like that, wearing a mask inside your home is a good idea. And then caregivers who are caring for people who have COVID-19, like in non-healthcare places, they should wear a mask. Also, they should be trying to avoid close contact as much as possible, and then washing the hands and disinfecting surfaces as much as possible too. All right. Now, who should not wear a face mask? Children under the age of 2 should not wear a mask. Anyone who has trouble breathing or anyone who is unconscious or incapacitated and does not have the ability to adjust or remove a mask, they should not wear one because these individuals are more at risk for suffocation with the mask. All right. So this graphic just shows how to select a mask. And it's important to find a mask that has 2 or more layers that are washable and breathable too. You'll want to completely cover your nose and your mouth and make sure that your mask fits snugly against the sides of your face and you don't have any gaps in there. Things that you want to avoid doing is a mask that has a fabric that's not very breathable, like a vinyl mask. We don't want you to use masks that have exhalation valves or vents because those could let the virus particles escape. And you don't want to use a mask that's intended for healthcare workers like the N95 respirators or surgical masks. This graphic just shows how not to wear a mask. So again, you want to wear the mask over your nose and your mouth and make sure that it fits under your chin and it's just snug to your face. That will give you the most protection from COVID-19 and other things. Okay. Some special considerations, just have some caution about gaiters and face shields just because the effectiveness really isn't known at this time. And then people wearing glasses, that can be a little tricky with a face mask. So if, like I said, if you can find a mask that fits snugly on your face and ones that have the wire nose piece can really help with limiting the amount of fogging that you get with wearing a mask with glasses. And then children. If you can find a mask that is designed for a child to wear, that is the best. If you can't find a mask that's made for a child, just finding one, again, that is fitting good for their face, so it's snug against their face and it covers their nose and their mouth and fits under the chin. And just remember, children under 2 should not wear a mask. Okay, and then cleaning your mask. You'll want to wash your mask regularly. You can just put it in with your regular laundry. It is important to use the warmest water setting for the fabric that your mask is made out of. And then the highest heat setting on your dryer to dry it. And you'll want to wait until it's completely dry to take it out and use it again. Okay. So pregnancy and COVID-19, we'll go into that. Oops. So are pregnant women at a higher risk category for COVID-19? Based on the information that we know at this point, it does look like there might be an increased risk for severe illness from COVID-19 compared to other women who are not pregnant. Additionally, pregnant women with COVID-19 may be at an increased risk for adverse outcomes like preterm birth. But following all the tips that I previously discussed can keep you healthy and safe during your pregnancy. And then you should always talk with your doctor if you have any specific concerns or questions. Okay. So breastfeeding. Many new moms also have concerns about breastfeeding during the pandemic. And is it safe to breastfeed my baby? Yes. Breast milk is still the best source of nutrition for a baby. The current evidence does suggest that breast milk isn't likely to spread the virus to babies. You should wash your hands before you breastfeed your baby or express milk. So washing hands with soap and water. Again, if you don't have soap and water available, you can use a hand sanitizer with at least 60% of alcohol in it. If you are feeling sick, wear a mask or cloth face covering when you are near your baby, just so that those respiratory droplets keep from getting on them. Okay. So what about infants in COVID-19? Currently, there is an increased risk for children with certain underlying medical conditions and infants under the age of 1 that they may be at risk for severe illness from COVID-19. Preterm birth, which is defined as less than 37 completed weeks of gestation, and other health problems with pregnancy have been reported among women who tested positive for COVID-19 during pregnancy. It's really unknown if these problems were related to COVID-19. Most newborns who tested positive for COVID-19 had mild or no symptoms, but there were some that were had severe illness. It's unknown if the newborns that were tested positive for COVID-19, if they got the virus before, during, or after the birth when they had close contact with the infected person. But you can protect your baby by following all of the tips that I previously mentioned before this, and staying up to date on vaccinations and also well child visits as well. All right, so well child visits during the COVID-19 pandemic. So another concern that we've seen with parents is about going into the doctor and making sure, that it's safe to go in. People, have been delaying medical care and well visits during the pandemic out of fear of catching COVID-19. But it is really important to continue, going and seeing the doctor. So is it safe to visit a doctor while we are in this pandemic? And the answer is yes. Well child visits are important to track growth and development, including milestones and social behaviors and learning, as well as it's a good time to discuss any concerns you may have about your child's health. it's good to stay up to date on the childhood vaccinations. The CDC and the American Academy of Pediatrics recommends every child to continue to receive their routine vaccinations during this outbreak. There's many preventable diseases like the measles and whooping cough that your children can get a vaccine for, and they're not at risk for those preventable conditions. So this is a chart that shows the recommended immunizations for children from birth through 6 years old. So you can kind of see how by delaying, well child visits for a couple months can really get them behind quick. And, you want your child to be protected against these serious and preventable diseases. Okay, so is it safe for newborns to be seen by a doctor? And that answer is yes as well. All newborns should be seen by a pediatric healthcare professional shortly after the hospital discharge. Ideally, newborn visits should be done in person, even during the COVID-19 pandemic. They evaluate feeding and weight gain and check for dehydration and jaundice. And they make sure that all of the components of the newborn screenings were completed as well. So it is really important to for your newborn to see the doctor after you get home from the hospital. All right, so doctors' offices are taking steps in a variety of ways to help prevent spread, in the office. So you'll see things like scheduling sick visits and well child visits at different times of the day. You may be asked to wait, outside or in your car before coming in, and that's to reduce the crowding in the waiting rooms. Most doctors' offices are screening patients for signs and symptoms of the illness before you can come in. And then there are some, reasons why you could use telemedicine visits instead of going into the doctor as well. So the last topic I would like to cover today is childcare during the COVID-19 pandemic. And, this is a big one for new parents. Is it safe to go to a childcare center? I mean, people need to get back to work. And so it's a very big topic right now. All right. So what safety measures are childcare programs taking? So they are all increased their cleaning of the facilities. They're routinely cleaning and sanitizing highly touched objects like toys and books and games. And they're also cleaning things that maybe were not cleaned as often, like doorknobs and light switches in classrooms, the countertops and nap pads, the toilet training seats, cubbies, playground structures, those kinds of things, all to prevent getting COVID-19. Another safety measure that's being increased is hand washing. Staff should be washing their hands with soap and water or using the hand sanitizer with at least 60% of alcohol. You always want to wash your hands with soap and water if your hands are visibly dirty. And then, increasing the amount of times that children are washing their hands while at childcare centers. So, before, eating snack or lunch, after going to the bathroom, those are all going to be, big times to wash hands. It's a good idea also to just wash the hands right when they get into the childcare center as well. So they should also have plans to contain illness. So, if people do become sick while they're there, to move, the sick people away from children or staff that are not sick before the parents can get there to pick them up. It's definitely important to keep sick children at home, and just having that dialogue with the parents to monitor their children and, see if they're having any symptoms or anything like that. Same thing with the staff members, requiring 6 staff members to stay home until they have met the criteria to come back to work and discontinue home isolation. They are going to be doing screenings for staff and for children for illness before they come in. Parents or guardians should be taking the temperature either before they leave to come to school or, upon arrival at the facility. Staff should also be doing a visual inspection of the children to see if they have any signs of illness, which may include things like flushed cheeks, being out of breath without any physical activity, extreme fussiness, those kinds of things. And if possible, sometimes temperature screenings can also be completed at the facility. You may also see altered parent pickup and drop-off processes. The child care center may consider staggering the arrival and drop-off times to limit the amount of people that are there at the same time. They may have the child care workers meeting people outside so parents, don't have to come in and there's not as much exposure in the building. They may designate some parents to be the drop-off pickup volunteer so that all of the children can come to the classroom at the to come into the child care center and at the end of the day when the children are going back to their cars. And then transporting infants in their car seats. All right, now I did want to leave some time to answer any questions that anybody has. Really, I don't see the chat box. Were there any questions?
I have one.
Sure.
So I have.
Sorry, I think I was muted.
I have a 2-year-old and my little one just turned 2 months old. I'm like really nervous about COVID, but they're regressing in their milestones. So we have a little group that we get together with, but like I don't know if I should, like what my plan of action should be.
Sure. I mean, I would definitely start with, starting with going to your doctor and seeing, sometimes regression, depending on what it is, can be normal, but it's definitely a good idea to go and speak with your doctor to see if there's anything else, that there should be an evaluation, to be seen if anything needs to be taken care of.
Okay.
Did that answer your question?
Yeah, for the most part. One is regressing in problem solving. So I've talked to, I've done the ASQ and talked to them about that. And we're working on those steps. And the other one is just with the my infant. He's having problems with communication already and his fine motor. Okay. So we're working on that. I just didn't know if it was anything to do with just sitting home.
I think your infant's about two months old.
That one I'm not so much worried about. It's more the 2-year-old.
The 2-year-old, yeah. I would definitely check with your doctor and see what they say. There are programs like early on for milestones that you can check with too, like if they're meeting those, they do an evaluation and see if there's anything that needs to be worked on. So that could be another good resource for you as well.
Okay. I'll definitely give them a call.
Thank you, Tiffany. Julie, can you hear me?
I can.
Okay, I have some more questions for you. What should I ask my child care provider about contact tracing? Is there something like, specific that they should be looking for, like if they're looking for a place or they have a place right now?
For contact tracing, like as in regards to like COVID-19, someone positive?
Yeah, I think the question is like, is there something that like, hey, should I make sure that they're doing if they're not doing it, if I understand the question correctly? Does that make sense?
So with contact tracing, what happens is when at the health department, when we get a positive case, we call them and we ask them who they have been had close contact with, starting a couple days before they became symptomatic. And we get a list of like the name and the phone number of the people that they have had close contacts with during their infectious period. And then from there, they would be under quarantine for a certain amount of time. It's depending on like if they live in the same home or if it was someone that was outside of the home. It's 2 weeks from that close contact during the infectious period. So with contact tracing, answering your phone, if they do get identified as a close contact, they do receive phone calls or text messages, and they just kind of keep track of the symptoms that they're having, if they're having any kind of symptoms. And they just get a list that they run through of symptoms and ask them if they're currently having any of those.
Okay, thank you. The next question is, do I need to wash my baby's hands for them as frequently as I wash my own?
It's a good idea to wash your baby's hands with soap and water, because babies do put their hands in their mouths. You'll just definitely want to, make sure to supervise young children. Obviously, you'll be washing the baby's hands, but avoiding close contact is a big thing too. So, but yes, I think that washing baby's hands is a good idea.
The next question is hand sanitizer healthy for babies?
I would probably not do babies with hand sanitizer, because they put their hands in their mouth so much. And you'll just want to definitely, monitor them like real well. I would suggest using like soap and water for babies.
Okay, let's see here. Sorry. Is the age of 2 a clear dividing line for masks, or is it more based on the ability or maturity of the child?
I think they use age 2 as, the age where, because they can kind of start to tell you things a little bit more. The CDC definitely does recommend that anyone under the age of 2 should not be wearing a mask, just because they may not be able to tell you if they're not breathing well or adjust it to take it off. So that's kind of the cutoff there. Anyone under 2 should not wear a mask.
Do you have any suggestions on how to build a child's immune system while also following safety procedures for COVID-19?
Definitely eating a balanced meal, getting a good amount of sleep, those will help. You want to get your vaccinations, that will help build a good immune system as well. And checking with your doctor, but taking a multivitamin sometimes can help as well to build a healthy immune system. And just, washing your hands with soap and water, that will help too.
Thank you. Okay, next question. Why shouldn't I wear an N95? Is it just to make sure the healthcare providers don't get them instead, or is there another reason?
It is important that, that the healthcare field would be able to have the N95s. Additionally, though, they are, when you get an N95 to wear, like in a healthcare situation, they are fitted. There's different sizes for them, and there's a specific process that you do to figure out what size fits you. Just wearing one in general, it might not be your size, and it may not be as protective.
Okay, thank you. Should I keep my infant at home instead of going out due to the pandemic?
I mean, I guess you have to do what you are most comfortable with and what works for your family. You know, going into a childcare facility, they are taking steps to keep, you know, the kids that go there and the staff as well safe. But there are risks with going in there. So I guess it's going to be more of what you can do and what you feel comfortable with, but there are definitely steps that are being taken to make sure that your children are as safe as possible there.
Thank you, Julie. I have one more question from the audience, and it is, kids get runny noses all the time. Do I need to keep my child at home for any symptom at all?
I mean, yes, there are a lot of the symptoms that come along with COVID-19 you know, are very common for allergies or a variety of other reasons. You'll want to keep an eye and monitor, you know, the symptoms. You know, a runny nose can happen a lot. Typically, you know, we're seeing 2 or more symptoms with COVID-19. So, you know, definitely fever, body aches, chills, you know, cough or new shortness of breath. You know, I know a lot of kids have allergies and asthma. And so, you know, if it's like a normal kind of thing, you know, with COVID-19, we're looking for something that is, you know, different or worsening. So just paying really good, close attention to what's going on with your kid.
Thank you so much. That really helps so much, and we really appreciate you, Julie.